there is always a stock of those testing kits. And at the end of it all, most mothers go and test it. And then when they are positive, those who turn out to be positive, the guideline says we should put them on attachment.
The commonest problem is drug stockouts. This paralyzes the whole activity because the drugs and the medical supplies are the engines of our services here in the facility. We are here to serve. We are all here, all departments are covered, but even now we don't have any drug.
Support from Ministry of Health and Global Fund, we've been able to have funding that is going to help us conduct and strengthen the district malaria task force to sit regularly, think through the major causes of why people are continuously getting malaria, but also strengthen the preventive measures. We know the preventive measures that government has continued to provide mosquito nets for mothers that come for antenatal, and also children that are attending immunization sessions at DPT3. But also there's a campaign, a malaria campaign that is kick-starting very soon. We are going to give out mosquito nets, and all this is geared towards preventing malaria.